I'm Dr. Benneth Husted, founder and medical director of Housecall Providers. House calls are in my blood. When I was a child, I made home visits with my father. I would sit in the kitchen with milk and cookies while he would visit with his frail elderly patients who could no longer come to his office. Later, when I was a medical student, my grandfather came to live with me for the last 3 years of his life. He died in 1981 of congestive heart failure. He had decided he no longer wanted to go back to the hospital, and I did the best I could to keep him comfortable during those years. Between 92 and 96, I continued to practice out of my home. My best year, those first 4 years, I netted $28,000, hardly enough to attract a practice partner, which was what I desperately needed. So at the end of 1995, several of us incorporated as Housecall Providers. I had worked for nonprofit clinics in the 80s and knew a little bit about fundraising and grant writing. Enough to believe that if I became a 501c3, that Robert Wood Johnson would give us $1 million and we would all live happily ever after. So over the years, we actually have received almost $1 million in grants from local foundations who've had the vision to see that what we were doing was important. In 2009, we started our own hospice program. So Housecall Providers is a single organization with 2 programs, but one really exists inside the other. We have 1,400 primary care patients with a median age of 83 and about 100 patients who are enrolled in hospice. Our hospice program has rapidly become the heart of this practice. And what we are learning on the ground, day in and day out, is how to integrate primary care with palliative care. We are leading the way for the nation in patient-centered care. 2 of the important things I have learned from our hospice. One is how precious this time of life is for people and how important it is for us to be there for them through the very end of their lives. The second thing that we've learned from having our own hospice is how essential it is to have a team to deliver services to patients. Over the past 18 years, our budget has grown to $8 million a year. This is in response to the growing need for our services, a need which is only going to increase over the next 40 years as the baby boomers age. It is an honor and a privilege to serve our homebound patients. We provide them with quality, proactive, personalized care. 100,000 house calls later, we want to continue to meet the growing need in our community.